Hello everyone, my name is Tawheed Najafi and I would like to discuss the healthcare systems in the United States and Germany and talk a little bit about the differences and similarities of these two healthcare systems. As you may know, it's been a while that the American healthcare system is demanding the reform for its high costs and barriers to care. As of 2019, 80% of Americans worry about healthcare being unaffordable to them, and 47% disapprove the system as it stands today. A 2017 survey of the healthcare systems found the U.S. healthcare system to be the most expensive and worst performing in terms of health access, efficiency, and equity among developed countries. All this despite the fact that in the US, the government spends about $10,000 per person on healthcare annually. In the United States, healthcare is about 17% of gross domestic product. Insurance plans are very costly, and most consumers are subject to a variety of co-pays, deductibles, co-insurance, and a lot of other fees. But let's talk a little bit about Germany. In Germany, healthcare is about 11.5% of GDP compared to the 17.1% in the United States, and they pay about $5,848 per capita. 77% of this expenditure is through the sickness funds. People pay around 15% of gross income for their health insurance plan, and that amount is paid equally by employer and employee. In comparison, much like the United States, it consists of insurers that cover people. Those who can afford it may purchase private insurances as well. However, unlike the United States, these sickness funds must cover everyone, and they don't make a profit. On the other hand, the government has a significant amount of control over the prices. Average out-of-pocket spending per capita in Germany is $731 compared to the $1,122 in the United States. In the US, service coverage depends on your insurance plan. If you don't have any sort of insurance, you'll pay the full amount for any service or provider that will accept someone without insurance. The Affordable Care Act created the essential health benefits that all insurance plans must cover, that you can see in the list here. If we compare it to the sickness funds in Germany, it's almost covering the same areas, including preventive services, primary and special physician services, and mental health, and the others that you're seeing in this list. Some of these services are subject to minimal cost sharing, but those are mostly co-pays of no more than 10 euros. In Germany, individual health insurance premiums for workers are calculated on the basis of income and not age or the number of dependents. Premiums are collected through the payroll tax deduction. This is why it is called that in Germany, the country has universal healthcare system, because it is coming from the tax deduction. These payments represent about 70% of healthcare spending. There are actually a few similarities in both systems. Coverage in both systems is provided through a large number of relatively small and independent plans. So we could say that the delivery of healthcare is similar to that found in the US. On the other hand, large number of employee groups reach agreements without direct government intervention in both countries. But let's check out some numbers and compare these two systems in a little bit more detail. As I mentioned, United States is spending more than $10,000 per capita, while Germany is limited to under $6,000. Germany pays about 11% of its GDP on healthcare, while the US pays 17%. Germany covers 100% of its residents with health benefits and insurance, but United States is about 90%. 90% of US population is about 30 million people, which is 1/3 of German population. Despite spending less, Germany has more reliable or similar health outcomes than United States. Life expectancy in Germany is 2.5 years longer than the United States. And infant mortality rate is lower in Germany with 3.3 deaths per 1,000, opposed to 5.8 deaths in the United States. Now I would like to speak a little bit about the advantages of the German healthcare system and see what United States can learn from this system, which is seem to be more successful than the United States healthcare system. The most important thing is in Germany, the insurers, they negotiate collectively. So they all get together, sit across the table from negotiators, and use this independent report as a point to inform the negotiations. It's clear, it is transparent, and it is public. This collective negotiations means that there is one price that is agreed to in the system, and then really importantly, different from the way we do in the United States. By doing what Germans do, we know, and even German population, and if we do in the United States, US population, will know that what the prices are and what exactly the costs are and what exactly the insurances are going to cover. This could result in a lot of transparency, and it will prevent lobbying in the system and changing in the prices, raises in the prices, and a lot of hidden prices that customers and the consumers pay. Or we can say in other words that this is going to stop black boxing in the US healthcare system. Another thing that US can learn from Germany, which is again in accordance to the publicity of the process, is making the drug review process transparent so public can watch and give comments. Germany's ability to provide citizens access to the latest drugs while keeping the patient costs so low is made possible by a novel strategy launched in 2011, mixing free market incentives to encourage innovation with regulation and lots of transparency. Germany's drug review process gives manufacturers the chance to bring new products to market and charge higher prices, but only if they can show the new medications are better than existing ones. This is something that we don't see in the US, and this will give doctors, hospitals, and patients access to not only new drugs, but also independent evaluation of how well that new medications will work and how they will cost, how much they will cost. And at the end, I would like to discuss some pros and cons of German healthcare system. It's not like they have the perfect healthcare system. There are some problems in the system. First, the pros, as I mentioned, there are fewer prescription dependency issues in Germany. Also, hospitals and prescription co-pays are exceptionally reasonable in Germany. As I said, it's not going to cost more than 10 euros for a German person to pay his share. Unlike United States, it is possible to combine the public and private health insurance options, which gives more freedom, economic and financial freedom to the people. And again, unlike US, employers cannot penalize you for switching from public to private insurance companies. However, there are some cons and some disadvantages in the German healthcare system. One of the weird of which is the doctors that do not make a lot of money in this healthcare system. The average salary of the specialized doctors in the US, in the Germany, is $75,000, which is far below that than the doctors and specialized doctors practicing in the United States. This is somehow lowering the quality of the healthcare and treatment in German healthcare system. On the other hand, medication is given less freely in German healthcare system. It's not like in Germany you go to doctor, visit your doctor, and freely, as United States, receive your medication. They will try all other possible options, including even herbal medicine and exercise therapy and the similar methods before they can freely give you the medication. The other problem is the dental coverage, which only uses the absolute minimal standards in the German healthcare system. And the last one, it is illegal to not carry health insurance if you live in Germany. I was reading an article that has listed this as a con, which says it is illegal to not carry health insurance if you live in Germany. But I'm not sure. In my opinion, it could be a pro and advantage of the Germany's healthcare system, because since it is cheap, it is making a mandatory to have healthcare coverage in the Germany, which is an important step in public safety and preventive medicine throughout the nation. This was a summary comparison between United States and German healthcare system, and I hope it would have been useful for you. Thank you.